is about releasing more time for the nurses to be able to care for the patients.
People like coming to work, it's not a struggle, we're a happier team.
Things have just become far more organised, and it is therefore also more fun to work together.
It's much better. Also saves us a lot of time.
There's generally just a more organised feel about the ward, less chaotic than it was previously.
Everyone benefits, patients, staff, the organisation. It's a win-win for everybody.
Productive Ward was a Department of Health initiative which was launched some time ago, and it's a productive series really. It's really looking at how we can improve the efficiencies of our different healthcare settings. So there's the Productive Ward,
He's able to scare.
there's a Productive Theatre, there's the Productive Community Hospital as well. It's been good for St George's because the ward team design the solutions to the issues that they've got.
Yes, our linear room.
Okay, that's excellent. So you've got everything in the same place.
The Productive Ward is a project that came about after some research was done by the NHS Institute for Innovation and Improvement that showed that nurses were not spending as much time by the bedside with patients as they wanted to. And they devised a framework which allows the nurses to look at the way they undertake activities and therefore give that time back to the patients.
You okay, Daphne? How are you today?
Oh, a lot better today, thank you.
Good, good.
It's trying to look at the ward environment to make it as efficient as possible so that the nurses come to work to spend more time with their patients, which is really what every nurse wants to do. And hopefully by being a much more efficient team, then not only does patient care and patient safety improve and patient satisfaction therefore, but also it's a nicer place to work and so staff satisfaction increases as well.
We just need a steer assessment before discharge.
It's the first time in my career in the health service, and I've been involved in management for 34 years, that we've got a really structured process that we can join boardroom and shop floor together with the opportunity to improve care to patients and improve the way we manage our staff.
What about so any kind of complaint trends or anything?
It's a very good score. What's the areas where people are not feeding back so positively? What's they saying to you?
The project's divided into a series of modules. Each ward undertakes 3 foundation modules which look at the way their ward is organised, and that's called the Well Organised Ward. They look at how they're doing so that they know what their tasks and goals are, and that's called Knowing How We're Doing. And then they look at where the patient is in their journey, the patient status at a glance module. And once they've undertaken those modules, then depending on what they find during that time, there's then a series of other modules that they can undertake at a pace that suits them and their ward's needs.
Cavell Ward's a very busy ward with some very, very sick patients. Productive Ward just gave Cavell Ward the opportunity and the direction to reassess how we were working and to work in a more efficient and smart way.
Whenever the Productive Ward was first implemented, one of the key areas identified was cleaning up the ward environment. We started in our storeroom. As you can see, everything's identified now. Everything's got a label, so we can just come in, eyeball it, take it and go back to the patient. Whereas before this happened, we were coming in looking for boxes, searching for it, wasting time. Now, as a result, we can spend more time with the patients, which is what the Productive Ward is all about. Something else that we have implemented since the Productive Ward is putting these trolleys at the end of every bay. Instead of us running to the storeroom all the time, it's got basic stock equipment such as cannulas. Don't have to spend time actually running to the storeroom. It's just here and it's very handy for us.
Here we got the sluice room. Before the Productive Ward, it was very, very messy. Everything was scattered around this place. The linen bags were stored in a different place. Everything was on the floor and everywhere. So with the Productive Ward, it has helped us to put everything in place, everything organized, everything accessible, so that patient care can be very effective. Also decrease the time that we spend looking around for all the unnecessary things.
This board relates to the Knowing How We're Doing module. And basically it's either what we call a PIES board or a performance board. We collect data looking at the patient experience, safety, efficiency and staff well-being. Most of the data is collected on a daily or a weekly basis, and all the staff can access this board, know how we're performing and what we need to improve on. And also patients obviously can access it and see how we're doing in our patient experience questionnaire.
Process mapping is one of the techniques you can use in the tool book. It's looking at every little thing you do, so we looked at our handovers. So this is what we wanted to include and that we are including. So this one's check oxygen and suction, nurse in charge to hand over to the other nurse in charge. We looked at how long we spent doing such and such, did we need to do it, how many interruptions we got, and once it was up on the board it gave you a different perspective, so it was very beneficial.
Right, we're now all the way to patient communication.
We're able to carry out direct time care audits. This enables us to identify which areas we need to address following one member of staff for 12 hours, identifying where they spend the most time, and this just helps us focus more and address where there are problems on the ward. We're able to see these numbers after putting them in the computer and printing out and seeing that we need to address certain areas. For example, our medicines module takes the longest time.
This is our patient status at a glance board, and this identifies a patient's status through their journey or pathway from admission to discharge. It's used by all the healthcare professionals on the ward. They each have a column that they contribute to. We use a counter or a symbol system or abbreviations to avoid lots of writing. The idea is that you can glance at the board and within 3 seconds learn the status of a patient.
These patients are under surgical, and then my activities have been up.
Board round in the mornings, which is one of our key elements in being more efficient, gives us at a glance the overview of where each patient is in his or her journey and what expert reviews or investigations we need doing. And as it's a multidisciplinary approach, everybody in the team knows exactly where their role is for that patient's care.
The Productive Theatres is part of the Productive series from the Institute of Innovation and Improvement. Started here in St George's in day surgery, and since then we've rolled out to Paul Calvert Theatres, our orthopaedic theatres. So far in day surgery we've implemented some foundation modules looking at where we store things. The staff have worked really hard on improving their storerooms by surgical specialty, colour coding and labelling, and they've also done that in their instrument rooms, and they've started to standardise the anaesthetic rooms so that all the rooms are the same.
The Productive Theatre helped us rationalise our space, our environment and our stock. Ultimately at the end of this benefits the patient, and for us on a day basis it meant that things were more accessible, things that should be together were together, everything was just more sensibly organised. It helps you make the most of the space that you have and just control your environment, so it's a safer environment all round.
Community Services Wandsworth is a large part of St George's Healthcare Trust. It's one of the divisions, and it provides services to people who live within their own homes or as close to home as possible.
The Productive Community Hospital is really looking at how we can take each individual clinical environment, look at the problems that they have and really try and work with those teams so that they become more efficient, and with greater efficiency they're able to then release more time to care for patients, and that's the strapline for the Productive series.
For community services in particular, what it has meant to some of the patients is that we've got improved patient pathways, so there's much more smoother flow through their journey through healthcare.
I think one of the best things about Productive Ward is it's really a bottom-up approach. Those areas who've really been doing it for quite a long time really do begin to notice the difference that Productive Ward can bring to their environment.
We
we have our basic strategies that we do use, but on Cavell it's very much a very busy surgical ward. So we're able to take these strategies that they've helped us to use and sort of make them unique to us and individualised. And this helps us because we're able to make it our own and make it useful to us and not just using a set of rules. So it's not blanketed across everybody. It's all about making it good for you, making it work for you.
I think the Productive Ward project is really good. It's really great for team spirit on a ward. They're working really well together, and it's great to come on a ward and see the staff smiling and looking like they're really enjoying their work.
I think it's a really good thing to have this programme. In essence, it empowers the ward managers to take control of their working environment. It gives them strategies, training, opportunities to actually influence what's going on. It emphasises quality of service. I think ultimately though, it reflects on the quality of care and the feedback we get from patients.
I think the key thing for the Productive series is we don't call it the Productive Ward anymore. It just becomes the way that we do things around St George's. So we really want to embed the best of the characteristics into our everyday practice, and it's something that we just all unconsciously do.